Hello again, Internet. My name is Conor Robinson, and I'm the Program Coordinator for the Humanist Service Corps. I'm here today with my friend and colleague, Rebecca Czekalski, and we are both wearing smocks. They have a proper Dagbonly name that I should remember and at the moment do not remember. But the more interesting part of the story about these smocks is that they were given to us by the same guy. His name is Razak Adams, and he's one of our good friends in town. He's also one of our main cultural resources. We've been hiring him for some odd jobs, but even if we hadn't been hiring him, it really seems like he would have been on hand to just be helpful and to steer us in the right direction with certain things.
Mm-hmm. He's been a great cultural and language resource for us.
Definitely, definitely. And he's got great English skills. So, I mean, when our own Dagbonly abilities fall short, he's definitely able to make up the distance for us.
Mm-hmm.
Anyway, like I said, Rebecca Czekalski is here with me today. And if you've been following the blogs or the Facebook posts, you will probably have picked up on the fact that she has a very unique perspective, and it's in large part because of that unique perspective that she's here, and the strengths that she developed coming from that unique background that she comes from, that she's here. So I'm going to give her just a little bit of floor time to share a little bit about where she comes from.
Okay, well, I was raised in the Independent Fundamentalist Baptist movement, which, if you're familiar with Southern Baptist churches, IFB churches can range anywhere from a slightly more strict King James Version of the Bible preferring church all the way to a self-enclosed borderline cult compound. Totally depends on which end of the IFB pool you're swimming in, and also varies from church to church. I was in for those of you who are familiar with the IFB movement, my father was a Ruckman acolyte to start off and eventually became a follower of Jack Hyles. We also were heavily influenced by Alan Jones and also later on Gothard as we got into the quiverful ideology and became much more involved in the homeschooling movement. So I am one of 9 children. I am daughter number 3. So I am just with that sort of background, being raised in such a patriarchal culture, it really does give me a lot of perspective for coming into the Ghanaian landscape and seeing, quite honestly, so many parallels between the Ghanaian landscape, how things work, especially in northern Ghana, gender relations-wise. I see a lot of parallels to my own background there. It's actually quite stunning.
Yeah, so you've had I would say an ability above some of the other volunteers' abilities, and certainly above my own, to see commonalities here, or between here and between where and how you were raised. But it seemed like you've also had another advantage in the sense that you've spent, what is it now, more than a decade studying and living in Korea and Korean culture, right? Do you want to talk a little bit about that?
Well, I spent the 5 years before coming to Ghana living and working in Bucheon, South Korea. I've had an interest in Korea, Korean language, Korean culture since I was a young girl. So I've spent the better part of 20 years familiarizing myself with Korean culture and Korean customs, Korean history, and also once I got to Korea, learning and becoming fluent in the Korean language. And when you study a culture from a book, it's not the same thing as living within the culture, so not at all. Being in Korea for 5 years did give me that opportunity to be able to see how the theory of the culture plays out in practicality, which really has been great for coming here because I can take those skills that I learned being able to observe and absorb and understand Korean culture and now apply them to seeing what is different, what is similar about Ghanaian culture.
Right, and that was what I was mentioning. It's really seemed like, the process for you of moving from that book understanding to that, deep fluency with Korean culture has been one that's aided you greatly in then making adjustments to Ghanaian culture. Not that they're the same,
But they do have a lot of similarities. They're
Absolutely.
actually, especially out in the more tribal areas, they're both face cultures.
Yes.
It really surprised me. I had a conversation with one of our other volunteers after an official meeting, and he was saying something like, well, why do they do this? Why do they do that? And I was like, oh, yeah, the Koreans do that too. Yep, that's just a face culture thing. That's just how it's done, and made sense.
Yeah. Now, here I don't think they would call it face culture. I think they would call it relationship culture, or they would say, you can't afford to sacrifice your relationships here. But it's basically what you're talking about.
It's the same
right?
idea.
Yeah, or
just
at least
name.
very similar
Yeah.
ideas. Yeah. So how does one who hails from the background you hail from end up getting from where your family was? Where exactly was your family?
Buffalo, New York.
Okay, so like Canada Land, New York, to Korea. Like, how is it that young Rebecca even got the idea in her head that would lead her to 2 decades worth of, in-depth and eventually immersive Korean study? How did that happen?
Well, I was sitting in a camp meeting.
Okay.
And the preacher, Don Hardman, for those of you with an IFB background, was preaching about Lord, send me anywhere. And around that time, I had just decided that the religion was my own. I just made my own commitment of faith and just decided that this was going to be my life. I was about 11 years old at the time. And I remember being very interested in overseas service and thinking, okay, there's missionaries through my church every single week, and at least one a week, if not 2, but I've never heard them talk about going to Korea. South America, Central America, African countries, yes, all the time. Never had heard of one going to Korea. And right about that time, there were some regime changes and presidency changes in all parts of the Korean peninsula. And the Korean world was really making news right around that time, so I had started reading a few things here and there, and then just wound up becoming very, very interested and sustained that interest over 20 years. So once I figured I'd need a way to support myself, because I really, really, really did not want to get married and have 10 or 15 or 20 kids. Really did not want to do that.
I would love to hear at some point about how you diverged from that track as well.
Oh yeah, that's quite the tale, isn't it?
Yeah. So.
Yep. So I had become a nurse because I knew that it could support me financially, and also because it would be useful for getting visas. I worked in nursing for a while. After a time in nursing, establishing myself and getting the skills down, I went to Hyles-Anderson Bible College, Jack Hyles' flagship school. And while I was there, I happened to meet some Korean students who were also there studying, made a lot of great friends, and later on, a few years after that, one of them had told me about a school that was hiring, that was needing someone with a science background who could teach in English, who was willing to learn the culture at an IFB, very strict Christian school in Korea. So I applied and off I went.
So
Yes.
And that was a perfect opportunity for you.
It really was.
Notice
I
that
was
she
there 5 years.
Notice that she just sort of glossed over it. She's like, oh yeah, so I wanted to travel, so I just became a nurse because that would be a really easy way to make money and travel, as though becoming a nurse isn't its own ordeal.
Especially for a quiverful girl.
Right, especially for someone coming from that that strict background. So I'm sure I don't have to explain to you, Rebecca's got a lot more story to tell, and it's all interesting, and I hope you will continue following her blogs and our blogs in order to get more of that story. One of the main reasons that she's here, aside from the perspective she brings, is that nursing background. She's overseeing a medical project for us as part of our support of Sontaba, the women's rights organization here. Do you want to say just a few quick words about that medical project?
Oh, sure. So what we're going to be doing is we're going to be arranging a health screening and medical records data collection for all of the residents in Kukuo. No matter their age, no matter their gender, no matter how they came there, we're going to screen everybody. because about once every 5 years, the Tamale Teaching Hospital comes through Kukuo and does their own health screening. Unfortunately, those records are frequently lost or inaccessible. So what we're hoping to do is screen everybody, and that way have the records there on site in Kukuo, have each of the patients have their own records to keep, have Tamale Teaching Hospital have a copy, and then have one backup copy at Sontaba in case anything goes wrong, gets lost, gets destroyed, or whatever. And so that way they'll be able to have a good continuity of care when they are able to go to the hospital or get treatment or whatever they happen to need, instead of having to worry about will their records be there, will the records not be there, or go to the hospital thinking they have the records and the hospital doesn't have any records. So it'll just make things a lot easier. It will also allow for disease patterns within the Kukuo community to be identified, and health interventions, teaching interventions, medication interventions to be implemented, so that we know where are our health weaknesses within the Kukuo community and how can we try to prevent or get early treatment going for those types of issues.
Right, and so we can, using data, chart the course forward. And one thing that we want to make clear is that these records for the first time are going to be not just in English, but also in Dagbanli. So we've seen in the past, or we've heard in the past, that Sontaba and local NGOs like ActionAid and even government health services have made a great effort to increase access for the people of Kukuo to healthcare services. But those people haven't necessarily understood the very treatment they're getting, and maybe they've gotten forms at the end of whatever treatment they've received, but those forms have been unintelligible to them.
Right, they've all been in English.
Right.
So if we can identify which disease patterns are most prevalent, we could very easily have those health teaching forms translated into Dagbanli and therefore much more accessible to the residents of Kukuo.
Right. And then hopefully, breaking down those accessibility barriers and having people understand the healthcare that's available to them, they'll begin to avail themselves of it more, and there'll just be much better communication between the health professionals and the residents of Kukuo.
Yeah, we're hoping to make it so that the hospital is where you go to get treatment and walk out healthy, as opposed to the place where you go to die.
Right. Waiting for treatment forever and ever and ever until you go, and there's no more treatment that can save you. So, well, on that serious note, again, we keep doing a good job with these vlogs of ending on really heavy notes. But maybe we can distract you by pointing out once again these awesome pocketed smocks that
we greatly appreciate
from our buddy Razak. And I would also like to make an excuse for my motorcycle hair. I don't know if there's more that I can say there.
At least he's wearing a helmet.
Actually, this is wind hair. Don't tell anyone. Okay, that's it for today. Next time, I'm going to be interviewing the program coordinator for Sontaba, Miss Lamnatu Adam. She is a whirlwind of a woman and is probably a healthy percentage on the majority side of why we are here in the first place. So you aren't going to want to miss that one. Keep in mind that we are accepting applications right now for the 2016-2017 Humanist Service Corps. And as always, we are accepting donations. We really need your support, especially in the form of monthly donations if you're in the position. Even $5 a month helps. $5 a month.
Please buy me a filing cabinet.
We need filing cabinets for these new medical records. So
we need 3 of them, please.
Yeah. Just,
If
donate. You can. You really can. You can.